Hey everyone, my name is Justin White. I'm the CEO and founder of Senior Health Services. Thanks so much for watching. I wanted to come and chat with you real quick because I am getting so many reports from my clients and people coming in that are telling me about the ridiculous amount of mail and phone calls and just information that's coming in regarding all the changes that are coming this fall. So I wanted to basically clarify a couple of things and calm a little bit of the cacophony and stuff that's going on because there's a lot of confusion, and unfortunately it's only going to get worse with all the advertising. If it goes the way it normally does this fall, it's just going to get worse. So hopefully I can represent a little bit of a calm in the storm and provide a little bit of information where you feel at least a little bit better about what you're looking at coming and maybe understand a little more about why. So are there changes coming this fall? The answer is absolutely. Okay. The reason that they're coming is basically the government has either adjusted the way they're funding some procedures, or they have cut funding to certain parts of Medicare. And in the cuts, it's coming primarily to Medicare Part D. And I don't want to go into a lot of detail, but what you need to know as you're looking at this stuff is because of those cuts and the lack of additional funding going to the carriers and reimbursements for some of these things, the carriers, meaning the insurance companies, are having to go back into their plans and find ways to cover the additional expenses. And they're going to go in there and you're going to see the potential for higher maximum out-of-pockets, higher co-pays, higher co-insurances. You might see deductibles added to certain plans. You might actually even see premiums added to plans as they're trying to figure out where the funding is going to come from to cover what Medicare is no longer going to pay. In other words, what Medicare cut from the program. So, and to give you an idea of what it is, there's some procedural things that are going to affect people like on what they call risk adjustments. The carriers are telling us that's going to result in a net reduction in income to them that they have to figure out how they're going to cover that. On the medicine side, it's stemming from the Inflation Reduction Act that Biden signed into law back in 2022. And basically, to keep this as simple as possible, it has essentially tripled the liability for drug coverage on the carrier side. So this year, when somebody gets into catastrophic coverage on their drug plan, they're taking some very high-powered medications, and they hit the catastrophic level. Medicare covers 80% of that, and the drug companies don't cover anything on that this year, but Medicare covers 80% of the drug cost in the catastrophic level, and the insurance companies cover 20%. Okay, so that's all well and good. It was similar to that last year, etc. Next year, in January of 2025, it changes. And so when you hit that catastrophic level, first off, you're going to get there a lot faster, which is going to be good for some people that take a lot more medication. But instead of Medicare covering 80% at that point, they're going to drop way back, and they're only going to pay for 20% now. That is a gigantic funding cut coming through from Medicare. And then the pharmaceutical companies are going to give what I think is kind of a token 20% discount off the retail, and the carriers are going to have to absorb 60% of the cost as opposed to 20% that they're absorbing this year. So you can see that there's going to be an absolute tidal wave of additional costs that they're going to have to deal with, and that's the reason you're going to see major changes coming to your plans. So what do you do about it? Well, if you have an agent that you like and trust, you need to call that agent and you need to ask them, first off, verify what I'm telling you. And then secondly, schedule an appointment for a review after the 1st of October. That's when we're actually allowed by federal law to talk to you about the changes and the specifics to the changes that are in your plan. Now, you are going to get what's called an annual notice of change in the mail sometime towards the latter part of September that will explain that. And then when you get together with your agent, you can talk about that amongst yourselves. If you don't have an agent, you want to call an organization like Senior Health Services, for example, this is all we do, and ask for a plan review after the 1st of October. And I would get on the calendar pretty quick because those schedules are going to fill up a lot because they're expecting people to be shopping in numbers that they've not shopped in many, many years and possibly ever. Okay? If you have any more questions about that, please let me know. You can contact us through here. You can go to the website at seniorhealthservices.com and shoot us any questions that you need. Our services are 100% free. You will never cut us a check for anything. We just want to be of service to you and help you navigate whatever all this stuff is in its final form as it comes down this fall to help you stay happy with Medicare on into 2025. Thanks for watching, folks. Have a great day, and let us know if we can help you. Bye-bye.